Welcome to the Programmed Care Community Services Induction. In this presentation, you will be provided with an overview of our key policies and procedures for healthcare professionals who work with our disability, home and community care clients. Programmed Care is part of the Programmed Group and a division of Programmed Health Professionals. Programmed Health Professionals is our agency business where we provide staffing solutions to hospitals, aged care facilities, as well as disability care providers. The Programmed Care Division specialises in providing direct care services to clients in the community. These services cover disability, community nursing, veteran and aged care clients. Our team are available to support you every day on 13 10 95. When you call this number, you should select option 2 to speak with our dedicated disability services staff. When you are working with home and community care clients for Programmed, you must abide by our code of conduct. You must always provide your clients with good customer service and remember that when you are working, you are representing Programmed and our values. You should always maintain strict professional boundaries when interacting with your clients and should refrain from discussing personal matters. When you first introduce yourself to a new client, inform them of who you are and tell them that you are from Programmed Care. Programmed will ensure that you are given a full orientation to your clients, and if there is any further education or training required to work with a specific individual, this will be provided. You are expected to maintain your skills and education throughout your employment also. If you have any concerns or complaints about any aspect of your work, please alert us so we can work to resolve any issues with you. It is a condition of your employment with Programmed that if a safety incident occurs during work hours or while you are travelling to or from work, that you report it to Programmed immediately by calling 13 10 95. We also require you report any near misses for incidents or any risks or hazards on 13 10 95. As an employee of Programmed, you have a duty of care to your clients. You must be fit for work and perform your duties in a professional manner at all times. Depending on the client, you may not need to wear a uniform at work. In these cases, you must dress appropriately. Closed-toed shoes with good grip must be worn. ID badges should be with you at all times. You must have your mobile phone handy in case of emergencies, and you must be contactable while at work for both your safety and the client's safety. Do not answer the phone while driving, but instead call us back as soon as it is safe to do so. You should never use your mobile phone for personal reasons while at work. Do not provide your personal contact details directly to a client. If a client ever requests this, you must advise them to contact Programmed on 13 10 95 if they have any queries. As a healthcare professional, you should not obtain your client's contact details directly. Our team will seek to place you with clients that we believe will be a good fit for both you and the client. Our team will contact you via phone to discuss potential clients that you may be able to work with. We will provide you with a thorough brief about the client's care needs, services that will be delivered, and the required roster. Clients who have complex care needs will have training or shadow shifts with existing care staff before you are placed. The majority of our clients have ongoing care requirements, and staff rosters are typically sent to you 1 month in advance. It is expected that you work all shifts you are rostered. We expect all of our staff to be reliable and punctual for all shifts. If you are running late or cannot work one of your shifts, you must notify Programmed on 13 10 95 immediately. If you are planning to take leave, please notify our team as early as possible in advance. Many clients' rosters can be changed day to day due to the client's availability or due to other staff on leave. It is vital when you work for Programmed you are contactable on your mobile and you return any messages from our team as soon as possible, as there may be an urgent roster change we need to speak to you about. Please be as flexible and accommodating as possible to ensure that the client's needs are met and they receive consistent, reliable care. You should never discuss your roster with clients directly. If you have any questions or concerns about your rostered hours, you must contact Programmed. If you arrive at a client's home and the client does not answer the door, please call us straight away on 13 10 95, as our first priority is to ensure that the client is safe. Timesheets will be provided to you, and you must complete a timesheet for each client that you work with. The times that you enter on a timesheet must reflect the roster that we provided to you. If a client ever asks you to change your roster, leave a shift early, or stay back late, you must notify us on 13 10 95 before commencing any additional work. Most clients have strict funding restrictions, and we cannot guarantee that additional times that client is requesting can be paid. If the client is not willing or able to sign a timesheet, please make a note of this on the timesheet. Care plans and task lists will be made available to you for each client that you work with. Due to privacy reasons, we're unable to email or post you these. Our team will go through the information that you need over the phone, and a copy of the care plans or task list will be at the client's home. Please allow a few minutes at the start of your shift to read over these. It is vital that you only complete the duties and care as outlined in the care plan and task list. If a client requests that you complete additional tasks, you must check with Programmed before proceeding. If you complete all required tasks before the end of your shift, please use your initiative to find suitable tasks to complete, such as helping out with the house cleaning. If you're unsure of what to do in the remaining time, please call Programmed for advice. It is important that all staff always work within their scope of practice and experience. If you feel there is an aspect of a client's care that you are not trained in or experienced enough to complete independently, then you must alert our team before undertaking those tasks. It is a requirement of working with Programmed that you maintain your compliance. You must update your mandatory competencies annually, complete the NDIS module, and any other client-specific training. You must also hold a valid first aid certificate and update your practical CPR every 12 months. In some states, completion of a practical manual handling course annually is also required. If you gain further experience, training or education, you must notify Programmed so we can keep your details up to date. Annual performance reviews may also be undertaken with our team. You must maintain current documentation for driving clients if applicable. All clients and staff can register complaints without retribution and expect them to be addressed in a timely and professional manner. In the case of a report of unsatisfactory performance, this will be addressed with the staff member following our corrective action procedures. Programmed may be obliged to report serious misconduct to the relevant state authority, Police, Disability Commissioner, or the Australian Health Practitioner Regulation Agency APRA. Serious misconduct can include theft, working under the influence of alcohol or drugs, abusive behaviour, bullying and discrimination. Programme always seek to continuously improve and enhance our service delivery. Both clients and staff are encouraged to forward suggestions or feedback to our team. At Programmed, we are committed to the health and safety of our clients and our healthcare professionals. For the majority of our clients, our care management team complete home risk assessments prior to our staff commencing work. In some cases, the home risk assessment is not able to be completed by our team, and in these cases, we may ask you to complete a home hazard inspection checklist at the start of your shift. You must return this checklist to Programmed. When you arrive at a client's home, you must familiarise yourself with the environment. Be aware of any potential hazards and ensure the client provides you with an orientation to their home. Personal protective equipment, or PPE, will be provided by Programmed. It is recommended that you always have your own supply of gloves with you in case the client has run out or doesn't have your size. Program can provide you with gloves if required. Our team will regularly have safety conversations with you, and you should always ask our team if you have any questions or concerns related to safety. Please be mindful that home environments are constantly changing and hazards can arise at any time. These hazards must be managed before work can commence, and you must alert programmed if you become aware of any risks. If there is ever a safety incident involving either yourself or the client, you must call programmed on 13 10 95 as soon as it is safe to do so. We also expect that you report any near misses for injuries. If you ever have any concerns about a client's health or well-being, you must notify programmed of your concerns. This may include changes to the client's mental state, risk of falls, loss of appetite, pain or distress. Please also check the care plan in the client's home for any specific OH&S or emergency procedures that must be followed. The next two slides list some potential home hazards that you may encounter and should always be on alert for when working in a home environment. These include environmental hazards such as unrestrained pets, loose carpet or floorboards. There also may be electrical hazards such as frayed power cords or overloaded power points. If there is not sufficient PPE in the home, please alert programmed. Before using any cleaning products, you must read and follow the instructions carefully. Never use any homemade cleaning products or products which are out of date. Wear gloves when handling cleaning products and ensure there is adequate ventilation. If you identify issues with any equipment in the home, such as hoists, manual handling equipment, or cleaning equipment, please alert our team. Always be mindful of potential trip or slip hazards in the home, such as objects or spills on the floor. Please take care when driving clients in your car or driving to and from work. Make sure that you follow all the road rules and ensure you are fit to drive. You are only ever able to drive clients in your own car once you have provided all of the compliance documents to programmed. Training may be required where hoists are used in the home. We will discuss any specific client requirements with you. Please be aware that programmed have a strict no lift policy, and if you feel a client doesn't have sufficient manual handling equipment to meet their needs, please notify our team. Some clients that we work with may experience challenging behaviours. A risk assessment will always be completed for these clients and information to assist you will be provided. We expect all care staff to engage in positive behaviour support strategies when interacting with clients. You are never to use restrictive practice. Where there are any actual or perceived threat to your personal safety, you must remove yourself from danger immediately, but never leave the client unattended. Call programmed on 13 10 95 immediately or emergency services on 000. Staff must be prepared to act appropriately in emergency situations such as medical emergencies, gas leaks, fire or motor vehicle accidents. Staff must not place themselves at risk in emergency situations and must only assist when safe to do so. In an emergency, call 000 and when safe to do so, notify programmed on 13 10 95. Thank you for attending today's session. Please take this opportunity to ask any questions regarding our policies and procedures for community care.